Good afternoon, everyone, and welcome to the Recovery Science Echo brought to you by BWell Texas and the Center for Substance Use Training and Telementoring, CSTAT. My name is Shreya Prasanna, and I will be facilitating today's session. A few quick housekeeping notes before we begin. Please help us with attendance by entering your name, affiliation, and email into the chat. To access the chat feature, please click on the speech bubble icon at the navigation bar at the bottom of your Zoom window. To all the BWell Texas providers, please make sure to identify yourself during these sessions by entering your information into the chat, or if you're joining via phone, please email your phone number and name to bwelltx@ithaca.edu. We encourage everyone to join by video, especially for the discussion portion of the session. That said, regardless of how you've shown up today, we are just as happy that you are here to learn alongside us. We are recording these sessions for later distribution through the BWell Texas YouTube channel. Any information you put in the chat will not be shared in the recording. Please stay muted unless you're speaking, and we do encourage you to speak. If you join by computer, your mute button is on the bottom left of your Zoom controls. If you're on the phone, just press *6 to unmute. You can also use the emotions menu in the bottom right of your Zoom screen to raise your hand and indicate you have a comment or a question to share. You can also use the chat to share your perspectives. There are a lot of us in this space, so please keep your comments brief to allow others to speak up. And finally, please note that no protected health information is allowed in either the chat or the discussion, and that includes names, emails, addresses, or anything that can easily identify an individual. Towards the end of the session, our wonderful IT support Taylor will be sending out a link to an evaluation survey. Please fill it out for a few reasons. It gives us feedback on how to improve these sessions to meet your priorities, and it allows you to access free continuing education credits. This is a unique series, and though we're offering CMEs today, we would like to hear from you, the participants, what type of CEs you are interested in receiving during these sessions. All participants filling out the survey will be automatically entered into a raffle for a $30 Walmart gift card. Our didactic today is on digital recovery support services and will be presented by Dr. Brandon Bergman. Following that, we will be discussing a case presented by Dr. Karen Fortuna. We will start with introductions, followed by didactics, announcements, case presentation, and open discussion. Thank you all again for joining today's Echo. These sessions are what we make of them. We encourage you all to share your perspectives and insights in today's conversation. And with that, we will do some introductions. Sierra.
Hi, I'm Sierra Castillo de Martel. I'm a person in long-term recovery. I'm a postdoctoral researcher at Chestnut Health Systems Lighthouse Institute, and I am one of the hub members.
Thank you so much for joining us. Emily.
Hi, I'm Emily Hennessy. I'm Associate Director of Biostatistics at the Recovery Research Institute at Massachusetts General Hospital, and also a hub member.
Thank you so much. Cheryl.
Hi, everybody. My name is Cheryl Pacapelli. I am also a hub member, person in long-term recovery, and the project director for the facilitating organization in New Hampshire, overseeing all the recovery community organizations. Thanks.
Thank you so much. Brandon.
Hi, Brandon Bergman, Associate Director at the Recovery Research Institute at the Mass General Hospital. I'm today's speaker, and I'll be sticking around for the case discussion as well.
Thank you so much for joining us today. Karen Fortuna.
Hi, everyone. Karen Fortuna, Assistant Professor of Psychiatry at Dartmouth. My background is in social work, and I partner with peer support specialists to develop different types of technology applications, and really excited to be here today. Thanks for having me.
Thank you so much for joining us. Daniela.
Hi all, I'm Daniela. I'm the project manager for the Peer Recovery Innovation Grant. So good to see you all today. Thanks for joining.
Thank you so much. Andrea Hebler.
Hello, everyone. My name is Andrea Hebler, and I am the program coordinator for the ECHO sessions. Happy to be here.
Thank you so much. And with that, we will get started. Brandon, you can take it away whenever you're ready.
Great. Yeah, so hi everybody. I'm going to share my screen. We've only been doing this for like 4 years now. Hopefully I can do it. Does everybody see my screen?
Yes,
All right, and can you hear me okay?
yes.
Excellent. All right. So, yeah, I'm going to be talking about digital recovery support services, and we'll get into what that means, the objectives, the learning objectives of the talk, and so on and so forth. But just by way of very brief introduction and a bit of an agenda for our 20 minutes or so before we get into the case presentation. I'm Associate Director at the Recovery Research Institute. We're part of the Department of Psychiatry at Mass General Hospital. My research focuses at the intersection of recovery support services, social technologies in particular, so technologies that connect humans to humans or sort of peer-to-peer support. And I'm also interested, although I won't get into this too much today, in the life stage of emerging adulthood, kind of between adolescence and established adulthood. And so my research focuses in this area. I'm going to be talking a little bit about my research, but the research essentially more broadly with the goal of also talking about how this might look in day-to-day recovery support service settings. Disclosures in terms of my interests and those of the organizations that we're all here representing or not. So very, very brief introduction. And what I'm hoping to do is keep this to 20 minutes or less. So I'll probably talk quickly. Those of you that know me know I talk quickly anyways. So, but because I'm sticking around for the case presentation, I'll have these slides. We can always dive back into any of this. I would rather err on the side of going more quickly and getting through this more quickly to leave as much time as possible for the discussion and questions and so on and so forth. So as we all know at this point, for many of us, online mobile technologies are integrated in our day-to-day lives. You see some statistics here. There's actually a little bit old. I have to update them. This is also true for folks with substance use disorder, right? So when we look at different studies where that examine the degree to which people with substance use disorder, especially those that are seeking treatment or in outpatient treatment programs, they also are using technologies. And this is true for folks in sort of the broader recovery space as well. So these data come from the National Recovery Study led by John Kelly at the Recovery Research Institute, where we're all located. And so these is a nationally representative sample of people who, quote unquote, used to have a problem with drugs or alcohol, but no longer do. And so half identifies being in recovery. And what we see is 11%, this is all pre-COVID, by the way, used an online technology to aid their recovery in one way, shape, or form. And these are the different kinds of platforms they were using. And so that leads us into today's talk. We're going to get into a little bit more about like, well, what does a digital recovery support service actually mean? And in some ways, there are different definitions. And so we're going to settle on one just for the purpose of today's talk in many ways. Describe different kinds of digital recovery support services, including some theoretical work on essentially sort of like plausibly, like why would these make a difference in people's lives, right? Very, very brief summary on what we know from the research, and then some strategies that are informed in some ways, I hope, by the research to maximize the benefits or what we know about the benefits, but also to mitigate against potential risks, some of which at this point are primarily anecdotal, but that's where we're at. And so, yeah, what I'm going to do, I would be happy to like take questions or talk about it. But again, I know we have a lot to cover, so I am going to run through the slides with the understanding that we can come back to any of this at any point. I think it'll just be easier because people will have questions and I'm chatty. And so I don't want to get on too much of a tangent with on any one slide. So please know I am interested, very interested in what folks have to say, what questions people have. But in terms of the slide deck, I'm just going to run through them. So definition, again, really just for the purpose of today's talk / echo session. What is a digital recovery support service? And so specifically, it's a digital technology that's designed explicitly to enhance recovery processing outcomes. So to tap into what we think are helpful aspects or helpful elements of the recovery process. And when I say recovery, I mean, yes, reducing or quitting substance use, and then also all the other kinds of efforts to improve quality of life, recovery capital, and so on and so forth, in addition to the substance use part of what we think about as quote unquote recovery. Also, by way of today's talk, when I say digital recovery support service, we're talking about non-clinical services. So services that don't necessarily require a therapist to be there delivering it. And so here's just a bit of a chart to differentiate what people will often refer to as technology-based interventions. So these are, again, just for the purposes of today's talk, one example would be the therapeutic education system, TES sometimes is what it's called, where that is designed and delivered based on an existing therapy called the community reinforcement approach, right? Which is an empirically supported treatment to address substance use disorder. So what's the difference between something like that, which is a platform that delivers an empirically supported service or an empirically supported treatment rather, and digital, right? So you see sort of the difference between the goals, timeframes. Typically technology-based interventions have time-limited access. They're tested to be accessed over the course of like 12 weeks, let's say, whereas the digital recovery support service in general is meant to be, just like other recovery support services, meant to be accessed or able to be accessed over the long term. And you see some other differences here as well. I want to just kind of point out this or highlight this one in particular, where for the most part, technology-based interventions designed and delivered by quote unquote professionals, whereas digital recovery support services designed and delivered by peers, although of course those peers can have professional credentials and so on and so forth. I would also say, and I don't want to get too much into the weeds here, we can come back to this. One habit we've all gotten into is to describe the technology based on the platform itself, and I fall into this trap too. People will say like, "Oh, it's an app, or it's or it's a social network or whatever," right? To say something is a technology tells us very little actually about what kinds of service is being delivered or what kind of service is available to folks that are in need of services or seeking out services. And so what I am going to try to do, and again, we can embed this into discussion if needed, is to focus less on the technology itself, but on the type of service, right? So it could be like a meeting or a community. It can be synchronous, meaning like the service itself is being accessed in real time. People could access it, right, where they're like, it's asynchronous, meaning like people are chatting in an online community and they might have a post and somebody might respond to their post later on that day. That's asynchronous. So it doesn't have to occur in real time. The type of platform, how is it being delivered, right? Is it Zoom or other kinds of video conferencing? Is it a discussion forum? Is it like a social media site? Points of access. This is where oftentimes people will describe it. So can it be accessed via smartphone app? Can you go on your computer and type in a URL? Is it a kind of standard website application? We don't often talk about technology, right, as telephone, but that is also part of how services can be delivered remotely, right? And then who's responsible, who's overseeing it, who's delivering it, so on and so forth. There are lots of different kinds of digital recovery support services. We really are going to focus today on peer-to-peer digital recovery support services, right? So where technology is connecting peers. Okay, second objective. Let's describe kind of what we know about digital recovery supports with a little bit of theory. And so one of the grounding theories for me are Yalom's curative group therapy factors. There are some really interesting papers we won't get into that look at these group therapy factors. Actually, I do think I get into one of them. And we say like, okay, for these digital recovery supports, to what degree are they tapping into these curative group therapy factors? And so we see a list. And for my money, we take out some of these, the ones that are kind of grayed out. For the most part, the digital platforms can also help people theoretically tap into some of these same aspects. So installation of hope universality, it's this idea of where peers who have lived experience can provide hope to others through their own experience. Universality, the shared nature of peers connecting with other peers, right? So you see, there's no reason to think that digital platforms can't also offer the same kinds of curative factors that in-person services might. Right. So, and with some benefits where it might help get around stigma, right, or isolation, loneliness. And what I often think about as, again, theoretical benefits of digital recovery support services, there's a whole host of reasons I didn't get into today, just for the sake of time, where we can all think about many kinds of barriers, why people would be unable, reluctant, or just unwilling to access in-person services. Right? And so for me, the digital aspects, where there are lots of different kinds of benefits of the technology itself, there's also ways in which this remote access can offer a kind of low touch point, low threshold way to dip one's toe in the water. That's that's the point of that picture. And I actually won't get into this that much, but I do want to point out that these elements here in this box, these are kind of the usual suspects, I think is a way to put it, when it comes to what do we know about mechanisms of behavior change that explain benefits from other kinds of digital recovery support services. Most of what we know here is about mutual help organizations and AA in particular. We're learning a lot about other kinds of recovery supports, as you all know, empirically. But we think about positive recovery expectancy. So this idea that like people are going to expect or be motivated to engage in recovery supports because they expect to get benefits from them. They're going to gain recovery coping skills, confidence to handle challenging situations when it comes to recovery. And perhaps most importantly, or at least most to a sort of the most salient piece that recovery supports offer that other therapies especially don't necessarily offer are these supportive social networks where people can add supportive members to their network, and if they so choose to drop folks that are not a supporter from their network, right? And so this is a theoretical kind of explanation, right? We have a lot of work to do from an empirical perspective on whether this is actually how they work. So now I'm going to get into very briefly a little bit of what we know empirically when it comes to these digital recovery supports, but again, especially digital recovery supports that are based on peer-to-peer connection, right? But first, online recovery support meetings. So these are meetings like 12-step, but don't have to be smart, other kinds of all recovery meetings, for example, but that are occurring through digital platforms. So on the left, these data are not yet published. They come from an NIAAA award that I've got or that I'm leading to examine online recovery community participation over the long term, both in terms of folks who are engaging with a 12-step online network and then folks who are engaging with broader recovery support forums on Reddit. So these just come from the 12-step online recovery community in the rooms. And examine without, again, I can answer questions about it, but what I want to show you, and so these are folks who are self-selecting into this online community. And so by nature, we can make some assumptions that they have positive attitudes or are willing to engage with online platforms already. So I don't want you to look at this and think like, oh, this sort of general recovery sample, lots of people are engaging with online meetings. That's not necessarily the case here. So this is folks who are going to online 12-step meetings. And these are folks who are, it can be the same person. It's not mutually exclusive. And these are groups like Smart Recovery, Women for Sobriety, Life Ring, other kinds, some quote unquote non-12-step, but it's groups that sprang or sort of emerged after the initial emergence of 12-step groups in the 30s, 40s, and 50s, right? And so what we see here is just a slight decrement in 12-step online 12-step meetings for those who attended, but then it stabilizes out to 6 months. And then for those who are attending second wave groups, you don't really see much of a decrement out to, across time. So it's much lower in terms of other sort of non-12-step groups, but it's stable, whereas a slight decrement in 12-step groups, but that stabilizes over time. And this is a separate study from Sarah Zemore's Peer Alternatives to Addiction Recovery Support Groups. I'm botching that acronym. It's PAL. And so this is a secondary data analysis. Sorry, Sarah, if you know anybody that's here and you're seeing this recording. It's PAL. Peer Alternatives Addiction Study. That's it. Okay, glad I wrote it. So these are secondary data analyses. When you look at the red line, that's online attendance. So this is alcohol use disorder specific, and the blue line is for in-person attendance, right? And you see that people who are attending online meetings, they start out with a lower probability of absence. It's just abstinence. And this is one of the things that we're starting to see is that in samples, whether it's a treatment sample or a recovery community sample, for those who are self-selecting into online meetings or not, those who are selecting into, they tend to be more severe, right? And we can imagine a whole set of reasons why that might be true, right? If people are having a hard time, they're willing to try lots of different things and they're looking for lots of different solutions. So that's what we see. And then now this is 6 months and this is 12 months. And so what we see here though is by 6 months, online meeting attendees, they have similar probability of abstinence or similar likelihood of abstinence, and that remains stable out to 12 months. So there's more nuances to this study, but one way to think about this is those who are attending online meetings, they're more severe, and so they start out with lower levels of abstinence, but then as you follow this group over time, they tend to do as well as those folks who are not going to online meetings. Okay, so that's online meetings and what we know empirically, which is not much, but it's growing. I actually just saw another article that I have to read. Same study, Sarah's study. Chris Timko was also the first author. So more will be revealed. We're learning more and more every day about online recovery support meetings empirically. Online recovery forums. So this is an example of the online forums, readily accessible. It's called Stop Drinking. I don't have any stake in it. It's not commercial or anything. So I'm not promoting any of these in particular. The reason that many of these Reddit forums are studied is because they're readily accessible and because researchers can take the posts and look at the content, right, without necessarily blowing anybody's anonymity or risking anybody's privacy, for example. So they can just look at the content. So what do we know about these? There's a really nice series of studies that were done over the course of several years and looking at different kinds of subreddits is the term. These are online forums within Reddit, right? So these are Yalom's curative group therapy factors I mentioned before. And this group, these are the comments they looked at and the kinds of posts. And they found that lots of these posts mapped onto the curative group therapy factors, meaning, so if you're wondering, like, what's actually going on in these online communities or these online recovery support forums, there's a lot, right? It's people interacting with people. So as you can imagine, there's a lot going on. But by and large, the researchers that are looking at these content, they are finding on balance that there's more helpful interactions than not. And very little harmful info, which is really I think for me, it's always the thing I'm thinking about with these, especially with these initial studies. Everything's it's like, what are the advantages? What are the disadvantages? What are the benefits? What are the risks, right? It's really important that I think about along those lines. And the only other thing to mention here about online recovery support forums, and I'll kind of push through these also, is there's not that much on balance. If you're just going to like a random site, the engagement is very spotty, right? So in this, if part of what we're going to be talking about today, and I'm not sure, is how to work with folks showing up to recovery support service settings, recovery community centers, and so on and so forth, receiving recovery coaching. I do think it's important to know that many of these sites, the vast majority of them, in fact, there's a lot of lag time between posts and so on and so forth. There's a really nice, Jason Cold is a colleague of ours. He actually came to RRI, the Recovery Research Institute, yesterday and gave a talk. So I was reminded of this. He has this nice dashboard where they're not necessarily saying like, here's what we know or here's what you should do, but it's providing more information on, I think it's like 211 maybe. I know that's how many came out of his study. But here's a link for those interested to learn more about the different kinds of forums that are out there and freely available. They don't cost anything and they're easily accessible for the general public. So these data they come from the same online recovery community study that I mentioned before that we're conducting at the Recovery Research Institute. We're following folks over time. These just focus again on in the rooms, but we ask people why. Why are you using in the rooms? What is it about this that is drawing you to these platforms, right? And so you see here is just a rank ordering. We actually this was not an open-ended set of questions. This was a set of predetermined choices, but then we did give another response. So just to be clear, these are not like coming from some qualitative interviews that I did with them. But you see, I mean, this is what sticks out to me. Yeah, currently abstinent, want to stay abstinent, not that surprising. But this piece where like 77% of them say it's because they can access online services at any time. So that stuck out for me. So sort of 24/7 access, that is one of the big ticket items that's drawing them to these platforms. A little bit more recovery support, recovery specific social network sites. I'm just going to move through these. I do want to highlight that it does tend, the people that are more engaged, they tend to be folks that are more severe. That's about, I keep saying that because it's like one of the things we know to be true empirically so far. So I can say that with a pretty high degree of confidence. Last, so I do want to point out potential drawbacks, right? And so really the privacy bit, very important, and this digital divide. So we're doing better as a, certainly within the US, I can't speak internationally in terms of access, right? If people are, if we're talking about digital recovery support services, and as we learn more about them, and if they're shown to be helpful in one way, shape, or form, or useful, and we want to be able to include them in our referral strategies or different kinds of comprehensive recovery support plans, people better have access to the technologies and be able to have like seamless internet access, some kind of broadband access. I know at recovery community centers, that's one of the things they can get, but as of, I forget how long ago, these were, 2021, 75% of people had access to broadband internet, but 25% didn't. And as you might imagine, that breaks along socioeconomic and racial and ethnic lines like everything else in this country does, right? So it's really important that we be thinking about this, and on the research side that we're trying to get a sense of equity, potential equity issues here. And then when it comes to these groups, you sort of like, it can be the wild, wild west. That's why the dashboard, the link that I put in is really helpful. And then in terms of tips for referral, there really is no substitute for going and exploring the service yourself because of how little we know at the moment empirically. And some potential tips for peers in terms of ways to enhance privacy, especially if they have concerns about that. Totally get that, very warranted. And then as if we're in a position where we're making referrals, it's really important that we're checking in regularly. And one of the things I can say is the degree to which we are helping folks tap into these tried and true mechanisms of behavior change that we know to be explain positive outcomes, enhancing social support, enhancing confidence, shifts in their motivation or their readiness to change, or feeling like they can speak up if they're not really sure what they want in terms of their recovery, right? So sort of ongoing check-in, and then sort of ongoing checking in about risks and any potential quote unquote side effects or downsides to participation. So I think I'll stop there. Again, can come back to any of this, but I really want to give us a chance to move on to the case discussion. So thanks for your time. Here's my email. Reach out as needed.
Thank you so much, Brandon. This was a wonderful presentation. We do have some time for some questions from our learning community here.
I can kick us off with a question. Brandon, what do we know right now about co-use of in-person and digital recovery supports?
Yeah, good question. So these are also from the study that I've got funding for. So like these data will be published, but at the moment they're like not peer reviewed. So take everything I'm saying with a bit of a grain of salt. We do in people that are accessing these online platforms. So in the rooms, for example, there is a high degree of co-use. So I want to say we split the group into 4 mutually exclusive subgroups. People who were going to online meetings only, in person only, both or neither. Now, again, they were in an online community already. We're just talking about online meetings per se, right? And there was a very small percentage that were going to neither, and a small percentage that were going to in person. So, and by and large, I forget what the percentages were. I can come back to it. But it was a high percentage of co-use. Now, when we look to see what predicts better outcomes, and we put both in-person attendance and online attendance in the same model and treatment, it was only in-person attendance that was a predictor of abstinence over time, right? So what does that mean exactly? Hard to say, but we do know that if in terms of how people are doing over time, at the moment, in-person attendance is a much stronger predictor of people doing well versus online attendance and versus treatment as well. The only thing I'll say, Sierra, is there are a few different comparisons that we should be interested in, right? So this is a question we get a lot, I get a lot, and I think it's a good one, which is like, how do in-person and online services compare to each other? You weren't really asking that exactly, you were kind of wondering like about co-use. But it's this idea of like, what are people's outcomes if they're going just to in-person services or meetings? What might their outcomes be if they're going just to online? And what would their outcomes be if they were going to both at the same time, right? One of the important comparison groups is nothing. Right? The vast majority of people we know with substance use disorder are not seeking out services. And I don't just mean like specialized treatment. I mean any kind of service at all. Much larger conversation about what we as a field can do, like sort of systemically, to do a better job of engaging more people in the process who might otherwise want to seek it, right? But one of the important comparisons here is online services compared to not receiving formal services at all, right? Because they might be willing to go to an online meeting or check out an online community. This low threshold doesn't require that much of them. They could be anonymous. They don't have to announce themselves or whatever. So that's in addition to what you were asking, Sierra, it's another important comparison is online versus not receiving any formal services at all. More to say, but I think I could stop there for the moment. I'm also going to pull up the data because I want to be able to actually answer your question. But do folks have other questions?
Hi,
Cheryl.
Brandon, this is Cheryl. I was just wondering if, you saw any specific demographic that did better in online meetings only.
No, it's a really good question. I cannot speak yet to doing better or not as well yet in terms of
Okay.
but what I can tell you, and again, I want to pull up the data so at some point, and I will tell you so I can say this with some degree of confidence. In this nationally representative study, when we looked at who was more likely to use online versus not who did better or worse, but who was more likely to use, there were a couple of subgroups that came up that were somewhat surprising. So first is people that were in lower socioeconomic strata, which is one of the reasons I bring up this digital divide, right? So when you compare people that had household incomes of $30,000 a year or less, they were more likely to use an online recovery support service relative to folks who had incomes of 100,000 or more. Again, so it's a total post hoc explanation. I talked about this with Sarah Zemore a little bit also. So she's part of this group. They're at the alcohol research group in California. They do really good work too. We're trying to understand what's happening here because there was also another subgroup. I want to say, I'm almost certain it was Latinx individuals. I think the breakdown was like white, Black identified, Latinx, 2+ races, I think it was something like that. And I want to say it was Latinx specifically relative to white. They were also more likely to use online services. So Sarah and I were talking about this, and again, we have to actually test these sort of post hoc, off the cuff hypotheses.
Right.
Part of it is that those who are in lower socioeconomic strata, they may have to be creative, right, about what they're doing to get services. It's not a good thing, right? It doesn't mean they have less access to services. So they might have, for a whole host of reasons, like lower access or barriers to healthcare, where they're kind of forced to use these freely available online platforms that don't cost anything. And Latinx individuals might have a whole host of reasons why they might sort of feel like it's sort of less safe, or they're not as willing to go and seek out healthcare services. The stigma in their communities, maybe. Again, I would be really eager to hear what other people have to say. But yeah, so that, to your question, we don't know who benefits more or less, but we are getting some sense of who's more likely to use these services or not. And it's those two groups in some of the studies that we're seeing.
Thank you.
Yeah.
Yeah, thank you so much. And thank you, Brandon, for this wonderful presentation. I will request the learning community to please keep the questions coming and in the chat, and Brandon will continue with his answers. In the meanwhile, we will move on to the next part of our session. Taylor, if you could please share the announcements from BWell. Thank you so much. So to claim CME credits, you must text by midnight tonight. Please text attend 1009-5851 to 844-502 1338 to record your attendance. Next slide. Do you have a research or evaluation related work in progress that you would like to receive feedback on? CSTAT offers you the opportunity to present a research or evaluation-based project and receive feedback from our community of experts. There is no need to prepare a formal presentation. We will share a case form with you to help you with your case presentation. Please email us at cstat@ithaca.edu. Next slide. The Peer Recovery Innovation Network invites you to complete a quick survey that will help us set priorities for the future of recovery research. Please answer the survey we are sharing on the chat and help us expand recovery science. Next slide. Join CSTAT for our session titled Mitigating Grief and Loss Post-Pandemic. This will be on Tuesday, May 21st. We will drop the registration link in the chat. Next slide. CSTAT offers technical assistance for various substance use disorders and topics via our team of experts. To request technical assistance, please complete an online request form and we'll be pleased to help you. And we'll drop this link in the chat as well. Next slide. Please note our next Recovery Science Echo will be on Juneteenth. And since the university is off that day, we will be meeting for our next Echo session on Wednesday, July 17th. Please make a note in your calendars. Thank you so much. And with that, we will move on to our case presentation. Karen, you can take it away whenever you're ready.
All right, great. Let me get this slide for us. So thank you so much for having me here today. I really appreciated the first presentation learning about digital recovery supports. All right. Earlier I mentioned I work with peer support specialists across the globe in developing different types of technology solutions to deliver peer support to other individuals. And what's really interesting about this approach is that what makes it very different than other approaches is that technology is the facilitator of the human connection, rather than really focusing in on the technology and all the features. And so when we think about some of the challenges around using technology, which my colleague mentioned, one of which is around training people how to use technology. And many individuals may not have adequate skills to use something like a smartphone app or virtual reality or other things. And so some opportunities there is that when we're thinking about digital recovery support, it doesn't always have to be virtual reality or an app, or it could be other things like social media, like the radio, like other things like potentially smart TV applications. And so when we think about training, one option is to integrate adult learning theory and create trainings for individuals which are offered, and align that with the American Disabilities Act to ensure people have the right resources so they can do their job. Another opportunity too is to think about technology as a reverse innovation for the delivery of peer support, meaning that we don't always have to use the latest and greatest technology that is out there. We can use what people maybe have in their hand, or maybe, wearing in their, on their arm or something along those lines. Also too, there is challenges with this as well in hiring the peer workforce. So I'm going to tell you a story where we hired peers who are older adult peer support specialists, which is an emerging workforce that's supporting other older adults with mental health challenges. And we hired them and we had an app and we trained them how to use that app. We spent 16 hours using the app and delivering this intervention. They went out into the real world, okay? And they're ready to go and use their app. And I'm monitoring on the back end because this is research, right? Like we have to monitor these types of things. And we found out that the peer wasn't using the app and they were engaging with the person in person, which was great. I mean, we're so happy about that. However, it was a research study and it was confined to this app. And I told my boss, okay, and this is egregious, okay? This is an egregious example. And I'm using this example because this actually occurred in the real world. So I go to my boss and I say, hey, you know, I trained these peers, I did everything I could, and they're out there and they're not using the app. And my boss tells me, fire the peer. They're not using the app correctly. They're not engaging in your research study. And I said, okay, you know, but then I went and I talked to my colleagues that are peer support specialists, and we were like, wait a second, we can't do that. We can't just fire someone. Maybe it was something with our training that was wrong, right? So I told my supervisor, give me one more shot, you know, let me see, let me go back to this. And we went and we met with the person and we gave them another training, and we found out that they weren't used to an Android app because they were used to an iPhone. Okay. So there are trainings out there. We may have to advocate for people because there may be this assumption that everyone can use technology. And it's hard. It's hard going from an iPhone to an Android or back and forth or learning new tech. I don't care who you are in this world, right? So that's just one example of some of the challenges where, as peers, as scientists, as, you know, people who are owning programs and services and within business, supporting people and making sure they can use the technology. And the same is with service users as well. Now, another major issue is the technologies that are out there, whether it's social media, whether it's video games where people are offering peer support. There's a lot of privacy and confidentiality issues. Even with even the biometrics, you can like wear a watch, right? And it might say, it's like a smartwatch, and it might say on there, if you read the privacy statement, which I'm not sure who actually reads that or actually can understand it, they may actually be selling data to a third party, and looking for words like, you know, sell, third party. Those are the key things. And now what happens if you're working for an organization and says, use this technology, right? And the technology isn't aligned with the values and principles of recovery and peer support? What do you do in that situation? Now, it's important to note that there are technologies out there that are aligned with those values and principles. And so just keeping that in mind and having an informed conversation, and not just saying, no, I'm not going to use it, but having informed conversation. Because what we're seeing now, new technologies to promote engagement in technology across people experiencing homelessness, those who are, you know, just previously incarcerated, and they're out there in the world, like the really vulnerable groups that are out there with low technology adoption. A lot of these technologies are offering options to share data or not share data. That's that little cookie statement that maybe people see when they go to some websites. So that's a challenge as well. And with that, there are opportunities and solutions, and it's about educating ourselves, educating service users on that as well, and then making an informed decision around that. And then, of course, what do you do about technology in rural areas? You see this picture. There's some, colleagues that are in Rwanda, where they're doing some really amazing things with peer support through like supporting like lived experience, and also like dancing as well, which is just a beautiful different modality of peer support for this group. And, you know, what do you do in cases where there's not a good Wi-Fi signal, right? Oh, well, you can go to McDonald's, you can go to the library, you can get on their Wi-Fi signal and their access, right? You can do those things. However, there are new programs and services that are out there and available that's being integrated into the technologies that offer adaptive systems engineering, meaning that it can operate on a super low Wi-Fi signal. So something like WhatsApp, we can text people in Rwanda right now. I think it might be late, so don't do those things, you know? But so those are the interesting features in the tech. So if you're selecting technologies, even if you're in New Hampshire and where there's a cloud in the sky and there's usually a blip in our Wi-Fi here, we lose electricity, even here at Dartmouth, if you can believe that. These rural areas, there are opportunities to offset these challenges. And so, you know, as I presented these challenges, I just want to share with people too that, you know, there are solutions out there, and, you know, these echoes can really help provide individuals opportunities to think about some of these solutions, and that, you know, technology can be very beneficial. But it doesn't have to be the only thing that's beneficial for peer supporters. It could be in-person meetings, and it could be opportunities to offset those challenges. So I will just stop there. And if anyone has any questions, I'm happy to chat.
Thank you so much, Karen. I see a comment here from Jordan. Digital meetings add another level of privacy. Individuals don't have to turn their camera on to share at all. So that's good, yeah.
I love that, and it's we called we created the digital peer support certification that's recognized by SAMHSA, and we call that video shaming, right? And so, hey, turn on your camera. You know, like after me, I have like 12 hours of meetings some days, and sometimes I don't want to turn on my camera. But imagine because of there's a cognitive effort and an extra cognitive load when we stare at a camera all day, even for an hour, like we feel tired afterwards. So something to take into consideration. And also too, imagine the person, the older adult that maybe is a peer, or maybe they're homebound and they're in bed and requiring people to turn on their camera. They may not want to. So again, going back to recovery principles and offering people choice around this. And then, of course, it's a training and you require people to turn on cameras, let people know. And then there's actually back-end features for the video conferencing, so you can tell if people engage, even if their camera's off. And feel free to follow up if people are interested in that. Because I really value not having your camera on and just doing so.
Thank you. Any questions or comments for Karen? Or if you have used a digital support service, a recovery and would like to share your experiences or challenges in using those.
I really liked what you mentioned, Karen, about how we don't necessarily have to invent new technologies, right? We leverage it can be something that's relatively low tech compared to where technology is today. And that might actually be more effective than trying to do something more high tech. I will just share the experience of was part of a group facilitating a large lived experience panel for the HEAL initiative, where we were doing a landscape analysis across a bunch of different populations. And one of the consistent things that I saw in the groups that I was facilitating, at least, and I think we saw this across other groups as well, but I can definitely speak to the groups I was facilitating, was the use of online like private Facebook groups or something equivalent to that on other social media sites, but that was the platform that came up in particular in these groups. And just how useful that was. And that's pretty low tech, right? That's very DIY. That's something that people are already using, and it didn't require anybody building an app or having any kind of technological know-how, but they got a lot of really valuable information that really made a meaningful impact on their life or in the lives of other people in their communities. And yeah, I think that's such a great example, or a great point to take home, that we can really leverage what we already have and make better use of what we already have instead of it needing to be something very technologically innovative.
And thanks for your comment, because yeah, I love that people are again it's about the human connection and not actually the technology. And don't get me wrong, we're developing like a AI, we're playing around with it as a scientific group and integrating AI into one of our technologies around peer support, and never replacing peer support. We're just seeing if we can create new methods around that. And we see that as a reverse innovation. So, and we did a systematic review of mental health peer support within digital technologies, and we did find that those informal groups did produce an impact on recovery, on wellness outcomes. However, where we saw the greatest impact was the one-on-one peer support with a trained peer supporter. So there's opportunities, I think, for both. And I do see a question in the chat. So in working with the question is, how do you navigate cybersecurity and privacy concerns when you're trying to utilize social media? So one thing we have done around this, and I'll pass it over to my colleagues to answer as well, is that we created a decision support tool for peer support specialists and service users. And so what this is, we brought together 50 peers from around the world, and we said, hey, there's all this technology out there. How do you select which one works best for you? And they identified things that were important to them. The number one thing that was important to them was privacy. And then it went cost. And then it went, is this technology focused on recovery, or is it more medicalized, right? So within that, we created a tool where a peer support specialist can sit next to a service user or virtually, whatever, and they have an informed discussion around what's important to them, and they circle it on this one-page tool. And then they have a discussion to make sure both the peer and the service user are informed. And then you make a decision about that. And so if you want to engage in tech, like it's going to be there, they're going to take your data, that is your choice. And so I'm happy to share this tool. It's been really helpful working with older adults with behavioral health challenges and talking about some of the things that are important to them, and even like cost too. Like cost came up as well. What if a psychiatrist is like, uses digital therapeutic, and then it costs a whole bunch of money, and be like, well, okay, is there something else I could use? Anyway, I'm happy to share, and I'll pass it over to my colleagues to answer as well.
I would love to see that tool, Karen.
Send me your email. You're in New Hampshire, right? Or
I am. I was
Oh.
on with your peer support specialist this morning at 10.
all
So-
right. Yeah, fabulous. If you don't mind, just put your email in the chat.
No,
send
I'll
it
throw
over
it right
too.
in the
Thank
chat.
you, ma'am.
Thanks.
So I had one question around the ability and, possible workarounds for, confidentiality regulations, with being able to get those consent forms, those releases of information signed, especially for people that do not have higher tech phones, individuals like my father who do not have a smartphone at all. And I know like we're moving into this space where everything is based on an app. For example, I had to help this poor gentleman who broke down on the side of the road to try to get a tow. Trying to use his insurance roadside assistance, there wasn't an option to speak to a live person. You could only have a link sent to your phone. He didn't have a smartphone, right? So it became like this entire process. And also from, a cost perspective, right? So with smaller organizations that can't afford the, the fees associated with some of the larger, like electronic health record platforms. So like really like those easy workarounds, and, like current options, future options for folks to explore.
If I may just jump in here. So we actually do not see technology access as a problem anymore. I know that's a bold statement. I believe in it though, because there are programs out there right now for free to get people free or low cost technologies and free data plans as well. So you can tap into, I mean, it's a challenge getting it, right? And then training people on it, but there is tech available. So one thing is SafeLink Wireless. That's a Medicaid reimbursable smartphone. Every state has it. In Kentucky, it might take a month to get. In Connecticut, it takes a week and they get the latest and greatest iPhone. I'm like, that's awesome. Now listen, if someone is living in a residential facility, you can only have one device per address. So in the residential facility, add in apartment numbers, and then you can get more for each address. Then you can do Lifeline as well. It's just go online and do it. And you can peers can do this with service users. And apply. And then there's Assurance Wireless, which is more on the West Coast as well. So then there's also the State Assistive Technology Act. Every state, you can look it up now, New Hampshire, Georgia, wherever y'all joining from. Mississippi, okay? State Assistive Technology Act, Mississippi. There is a place in your state you can call, you can email, you can go there, whatever works best for you. And there is free and low-cost technology you can access. A lot of these technologies could even be things like smart wheelchairs. I mean, it goes beyond just phones, okay? They also have refurbished phones you can get at a very low rate. So there are some opportunities there. You also could do demos. So if you work with like a certain population, I don't know if everyone heard of those like baby seals before. It's like a stuffed animal, baby seal. And here, scientifically, it's shown to offset feelings of loneliness in older adults. And they can actually do a demo with you on that if you think, well, maybe that'll work for somebody. You know what I mean? Like, I wouldn't want to just go buy one of these baby seals because I kind of think they're creepy. It'd be actually nice to have a little demo for it. But if it works for someone, it works for someone. So again, that's the State Assistive Technology Act in your state, SafeLink Wireless, and then Assurance Wireless. Yeah, what about those who are above income limits? So some other opportunities there. Salvation Army, 211 as well. And then I'm actually out of resources at that point.
I see a question here from Alexis. What about the digital divide?
I'm happy to jump in if but more and more people are using technologies around the digital divide because of COVID. And we see that with people with diagnosis of serious mental illness, it's almost up to 88%. What about everybody else? There may be some other opportunities to engage using things like the landline or the radio. And again, it's a choice for folks. So I'll stop there. And Brandon, looks like you had some.
No, I was going to ask you, Karen, I guess, or for the group. I don't know much about the efforts to like improve the broadband internet infrastructure around the country. I just know like it's a thing. Our tax dollars are helping pay for it now at the federal level. Do you, Karen, or does anybody here know about any progress that's been made along those lines? Because that seems important to me, in addition to being able to have, smartphones that have 5G or 4G access or whatever the case may be.
Yeah, there's been massive progress on that. There was a series of federal funds that had been allocated and certain states applied for it. I think New Hampshire, we received one as well. And so they're putting in additional services up way in like the northern country near Canada, where there is, issues with technology. And even Sherelle, if you're over at the seacoast, we don't even have good Wi-Fi, which is pretty wild because it's a pretty busy area. So no, there's massive federal funds that have been allocated for that, and Verizon Wireless is doing some policy work and lobbying to increase those services as well. And I only know that because I was meeting with some people from Verizon, and I was like, oh, that's an interesting public policy they're working on.
Well,
and then also too, you can get a Wi-Fi extender if people in rural areas have challenges with Wi-Fi.
Yeah, thanks, Karen.
Thank you so much, Karen. And thank you all for joining today's discussion. In the interest of time, I will request Emily to please summarize today's session.
Yeah, great. Thank you. Thanks to both our presenters. This was a really interesting discussion. First of all, just from Dr. Bergman, to get a really good sense of kind of the different ways we use technology and the way it's used for recovery in terms of modalities. I mean, I have a whole new kind of vocabulary around talking about digital recovery support services. So it was really helpful, and also thinking through how things have changed because of COVID, but also because of all the advances that have been made and how those changes have impacted everybody's lives, especially folks that are working through their recovery process. It sounds like there's still a lot of research to do in this area, especially really to understand how people are using and understanding technology. And to Dr. Fortuna's point, really, just because the technology is there doesn't mean that people understand how to use it, even after some training. And so doing some of that on the ground work to talk with folks and get a really good sense of how are they using it, what are the barriers, that requires a lot of kind of pilot work, I think, in that space. And then also Dr. Fortuna gave us a wealth of resources around how to reduce that digital divide and help a lot of individuals maybe gain access where they might not have had access to some digital recovery support services. So really fun discussion. I learned a lot, and I hope everyone else had a chance to as well.
Thank you so much, Emily. And thank you again, Brandon and Karen, for joining today and participating in the discussion. And thank you all again for joining today's ECHO session. As a reminder, to earn C credits, please complete a post-session survey using the link in the chat. And also, please remember to text the code 1009585 by midnight tonight, and you have the information in the chat as well. If you would like to present a case, please email the BVAL Texas team. We look forward to seeing you at our next session. Please remember the next session is not in June. It will be in July, on Wednesday, July 17th at noon. Thank you so much and have a wonderful rest of your day. Bye-bye.